and I'm the Director of Emergency Management for Ward County. I just want to welcome you all to our weekly press briefing. We'll be hearing from 1st District Health Unit today, Trinity Health, North Central Human Service Center, NDSU Extension, and the City of Minot. I want to let you know that we have a 3:25 cutoff time today, so we will have everybody present first, and please hold your questions to the end. Up first, we have Lisa Clute with 1st District Health Unit.
Thank you, Jennifer. I first want to take this opportunity to express our condolences to the family of the Ward County man that passed away this past weekend. That is sad and also a reminder to us as to how important it is that we continue to protect ourselves from this disease. I think I have some good news to share with you on the other hand. So I will run through the tests that have been conducted within 1st District Health Unit and the positive cases. So within 1st District, first is Botno, 72 tests were conducted and they did not have any positive cases. Burke County had 22 tests conducted, and they had 2 positive cases. McHenry County had 52 tests conducted with 1 positive case. McLean had 132 tests conducted, 2 cases were identified. Renville County, there were 26 tests conducted, and there were no positive cases. Sheraton also had 12 tests conducted, and they too had no positive cases. Ward County had 1,054 tests conducted, and we had 20 positive cases. So as a total, 1st District Health Unit serving the 7 counties had 1,370 tests conducted with 25 positive cases throughout the district. I wanted to also share with you some information. And I'm sure you're all watching Governor's press conferences. He always talks about percent positive to total tests conducted. And for the 7 counties we serve, we are at 1.82%. That is much lower right now than we're seeing across the rest of North Dakota. North Dakota's average is at 3.12%, and we know there have been some hot spots identified throughout the state, and those are obviously higher. But I wanted to share that with you because the role of public health is to educate the public on how to protect their own health. And so we provide you the information so that you know how to protect yourself from emerging diseases, any health threats, and so forth. When COVID-19 came on scene with us, and as we watched it move across the country, across the world, we provided you the information that we knew was ways in which you could protect yourself, which was by practicing good social distancing, limiting groups of people that congregate, and so forth. You know all of the recommendations that we've provided. We say it over and over again, and I just want to thank each and every one of you that are following these recommendations. You truly can applaud yourself that you are holding these numbers down. We certainly are not out of the woods. COVID is in our community, and we need to continue practicing these good preventative measures. And again, we can provide you the recommendations, but only you as an individual can choose to implement those recommendations. So it falls to you to protect your own health, and you guys are doing a good job. So keep it up. Just a few reminders that As social distancing has been around now for a little while, it's not near the novelty it was when it first started out, and maybe closets are cleaned out and maybe some drawers are cleaned out, and now it's getting a little boring and you're itching to go. Now's when we're really asking you to work harder and work hard at maintaining those social distancing guidelines and adhering to those. As the weather gets nice, outdoors are going to be calling you. We live in North Dakota. We have to get outside in the spring. That is what it is. But again, when you're outside, practice good social distancing. Avoid those high-touch areas. The other thing is now, we want to have outdoor birthday parties and so forth. We really would like you to delay parties, again, following those good social distancing practices. Delay your parties if you can. Obviously, if you've been contained within your home and you want to have a party, great. But to bring in other people into your homes or go to other people's homes or whatever, that is still not a good idea. You have to assume that COVID is in the community and it's your role to protect yourself from getting it, and you know how to do that. Wear your mask, social distance, avoid those high-touch areas. So, avoid those parties, avoid gifting in person. We all want to bring that neighbor a care package and so forth. Now probably isn't the time yet to do that. Come up with creative ways using technology in which you keep in contact. So, again, reminder to wear your masks when you're out doing business, essential services. But I also really want to take the time to applaud you. I'm proud of what this community has done, and I think you should be proud of yourself, how well you are practicing the good recommendations that we're providing. So, thank you, stay well, and stay tuned.
Thank you, Lisa. Up next, we have Randy Schwan from Trinity Health.
Good afternoon. So just want to run through a few notes, reminders. Some of this is we talked about before, but I want to give you a status update. So as we mentioned last week, we have continued to roll out video visits, telehealth clinic visits across many of our other clinics, both in Minot and out in the region. We have dozens of providers who are offering that now. And we know that during this time, people have been reluctant to or have been asked to delay their appointment, right? For various reasons, they didn't want to come into a building where there might be lots of people, or we were still getting set up for telehealth. And so now I want you to know that we've been fast forwarding that effort, and you might be contacted to conduct your appointment via telehealth if you're appropriate and eligible for that. If you're still seeking an appointment with your provider, call their office. Chances are they will be able to help you either in person or on a video visit. So just an update on that. Secondly, cloth masks. We are all wearing them. It's good to see everybody wearing their face masks. So we've been having great support from the community. Folks in the community have been quilting and sewing cloth masks for our staff, which we really appreciate. I know that they're in more demand now because you and I are expected to go out of this building wearing cloth masks in public. We've been asked to do that by the CDC and by the governor. So I think those are good things to do. At Trinity Health, as an organization, we are developing policies around the same. And so you are asked when you come in for a clinic visit, bring your mask with you because you'll be required to wear that in the building. And I know that we don't have tens of thousands of masks to give one to each of you when you come to your clinic visit over a period of days, so bring your mask with you. And we talked about how it's going to be second nature. You're going to start finding masks that are going with the outfit, color coordinating your mask with the outfit of the day. And we're not there yet. I'm not there yet, but we're going to get there. It's going to be a lot more comfortable as we go on. So please, if you have the ability to manufacture those masks at home, keep doing so, because we'd take more, and I know that your neighbors and friends would take some. I would encourage you to check with your local health system if you're not in Minot area, because I'm sure that they would accept them as well for their non-clinical staff. Of course, they do not replace the need for surgical masks in our facility. And we have asked for and have been getting a great response from folks in the 3D printing community. So we continue to get those donations from that community, and they're just an awesome group who are working together, not only in North Dakota, but across the nation, to provide their local health systems with 3D printed masks. And a 3D printed mask does, in our facility, we are approving their use when we need to reach into the reserve. We will use those 3D printed masks in lieu of a surgical mask. At the moment, we have surgical masks available. We have seen across the country how the supply of those surgical masks may disappear rather quickly, and we are preparing for the use of 3D printed masks in reserve for when that happens, if that happens here. We hope that doesn't happen. But folks have been doing a great job, and there's a website, a Facebook page, managed by the private community, ND 3D printed medical mask. Go to that site. All of us can contribute, whether we have a 3D printer or not. I went on the site last night before last, and was able to donate some supplies for that community to keep churning out masks. And it's only fair that I do that, and I ask that you consider that too. If you don't have the ability to print a mask out, that you might help them print masks out by contributing to their supply list. It's a really easy, painless Amazon purchase, so they're doing a great job, and kudos to them. I wanted to give you an update on our test kits. Again, we have test kits. We're offering drive-in testing at our First Care facility. By appointment, 857-5000, and if you meet the guidelines, you should be invited in for a drive-in appointment and be tested. Early on, we were limited in those tests, but we have several hundred on hand now. Seems that we're able to keep the supply going over week after week, so I invite you, if you have symptoms and you fear you might have contracted the coronavirus, call 857-5000. They'll walk you through the current guidelines and a survey to see if you're eligible for that test. And then lastly, I think it's not small news that Trinity Health last week and this week are walking through our furlough plan. We have implemented a furlough at our system, at our health system. I wanted to give you some insight around that. There might be some questions about that I can answer later, but let me just go through this and I might not have as many questions. So as you can tell across the country, unless you've not paid any attention to any news lately, health systems across the country are struggling with the same thing we are. We've been asked to reduce our surgeries. We've been asked to reduce our clinic visits. We've been advised by federal and state officials that that's helping to stop the spread, and we've complied with that. In doing so, we've also lost about 50% of our revenue. And so we've had to look at, across the system, we tried to delay it as long as possible, but came a day when it became necessary to adjust our staffing with our current priority, which is COVID-19 response. So for the first month or so, we were reallocating staff who might be in an area where there's lower volumes and lower business. We've been reallocating them to perhaps pass out food trays at the nursing home because they can no longer congregate as a group and be fed the normal way we used to. Now they're in their rooms and need to be a tray passed to every room. And the amount of staff that requires is in tens and tens a day. extra than what we used to have. And so we have labor pool, folks from the clinic and from the hospital who were not needed in their department, in their home department, to go to the nursing home and help us conduct those food trays. We have a variety of other tasks that we reallocated staff to appropriately in the same way. But as revenues decreased by 50% or more, we have to realign our staffing model so that we can address the current priority, which is COVID-19 response. And I've been asked this question a few times, and that's why I wanted to address it here. So have you furloughed your non-essential staff? And the answer is no. We furloughed the staff that we've needed to furlough, that were not needed for the task at hand today. Doesn't mean they're not essential. Every member of our team is essential. That's how we see that. And so if they weren't engaged in the COVID-19 response and fight directly in their home office where they went to work every day, they were reallocated until we had no more positions to reallocate to, and some of them were furloughed. So during the furlough, they have the option to use paid time off or take unpaid time. They'll have the ability to keep receiving their health benefits. We're covering that. They have the ability to have a temporary assignment through our labor pool if there are such shifts and such tasks that are needed to be done. We certainly look to them for that first. And finally, I think the bottom line to furlough is so that we can remain financially viable in the long term. That's our obligation, to serve our community, to serve our region, and meet the expectations and needs of the region long term. This is temporary. We know that, and we know that there is light at the end of this tunnel, and together we're stronger. Together we'll get through it, and together we will call back every member of that team to go back to work when our volumes return, and we expect that to happen in the near future and the mid-future. Your guess is as good as mine when we're going to be back to normal. The staff that were included in that furlough is system-wide, includes Minot and our rural clinics. It touches many departments. All departments, I would suggest, have to some degree felt the pain of these expense reductions. And when I say it's painful, I know it's painful for those who are affected, it's painful for the organization, and it's painful for every one of us. Another question that's commonly asked about the furloughs and the expense reduction plan that we've implemented is it affecting your new hospital complex, the build, the project, the construction project? And the answer to that is no. We have paused a number of other construction projects around the facility. We are not replacing carpet in that building. We're not going to repaint that room. Some of the capital equipment that we wanted to buy, we're not buying. So some of those decisions are being made, yes. But the mission-critical projects, and we see that new construction, replacement hospital, medical park as a critical project, will continue on an appropriate timeline. There was a pause in the construction during the transfer of from one construction manager to the next. As you know, that was well reported a few months ago. And I know that there is activity going on there now, and there will continue to be activity going on there. That's all I have for now. I'll come back with answer any questions.
Thank you, Randy. Up next, we have Tammy Ness with the North Central Human Service Center.
Good afternoon, everyone, and I'm happy to be here again. I first want to remind everyone to make sure that you are keeping in mind the emergency services contact phone number for North Central Human Service Center, which is 857-8500. Make sure that you are using that resource for anyone, yourself or family members who may have a mental health or substance use issue that's occurring during our COVID crisis. I wanted to inform you that we are moving to a phase 2 of rolling out the emergency services expansion, and that will occur on Thursday, where we will be gathering a group of law enforcement, hospitals, clinics, and public health nurses who are in Region 2, and we will have discussion about how to coordinate and collaborate services for crisis intervention. And so that includes everyone from, Trinity Medical Arts to the hospitals who are out in Kenmare, Stanley, Rugby, and those law enforcement agencies as well, so that everybody knows how to easily access those services remotely and through our system. So the rest of today, I'd like to talk about how we manage behavioral health symptoms as people begin to notice the impact on them related to a disaster situation. And there have been significant changes to our daily lives, everything from homeschooling our children to working from home, which is much more challenging than anybody would have thought it is, to not getting as many hours or being laid off in your employment. These are all major changes that are happening in our lives, and with that kind of major change, it becomes very uncomfortable. We're not in our routine, and the tension begins to build within our home and even within our own personal daily lives. I think the biggest thing for myself in trying to think about, what helps me to manage those situations. I'm not immune to it. Our doctors, nurses, health professionals are not immune to it. Everybody struggles with this same issue. But for me, I think it's focusing on controlling the things that I can control. And so I just want to list out some of those for you. Things like, do I use my protective devices? Do I wash my hands? Do I wear my face mask? Do I practice social distancing? Those are things I can control. The types of foods that I eat, what kind of beverages I choose to consume, do I choose to exercise or not? I can control those things. How much time I spend on social media and what kind of articles do I choose to read on social media? Do those help me? Do they not help me? Who and what I allow to influence my thoughts and my beliefs about what is happening in our world today, and what activities my family is engaging in. Those are the things that I can control on a daily basis. The things that are not in control are the things that tend to cause us symptoms, and it's things like, when will this end? When will I be able to go back to work? Will I be able to go to prom or graduation, or will my wedding be postponed? And how big of an impact is COVID-19 going to have in North Dakota? Those are the things that we cannot control, but usually end up taking a large amount of our thinking process that goes into the symptom development that happens when we're in crisis. So again, control the things that you can control. So it's easy to say, control the things you can, but that doesn't mean that my symptoms are going to go away. So how do we do that? And so I just want to go through some of the symptoms that are very common during the time of a disaster, and just some ideas about how you can try to manage that. I'm hearing a lot about people being lonely and feeling very isolated. Ideas about creating your own community. And what does that community look like when we are social distancing? There's a lot of people who have done some creative things with Zoom and I saw some videos about Easter dinners where everybody got on a Zoom camera and was eating their dinner together or playing games together. There's also the ability to join online support groups. Both AA, NA, and mental health support groups have online options for people today, and there's many more. I can't imagine that there's not a Help for Homeschooling Parents support group out there right now, just because everybody is struggling with trying to find that balance between work from home, homeschooling your children, managing day-to-day needs that are not easy to access anymore. Dealing with being tired or having sleep problems We encourage you to stay on as normal of a schedule as possible. Avoid taking naps because that disrupts our sleep system or sleep cycle. Avoiding alcohol and using exercise as a way to help manage sleep problems. The next one is irritability and moodiness, and I'm going to kind of tie that into anxiety and antsiness as well. But we use a term called emotion regulation in therapy. And emotion regulation is really trying to figure out how much gas do I put on this emotion, or how much do I let this emotion just glide by. And so when I think about, sadness, and I recognize being sad, it's okay for us to have sadness and to acknowledge that that emotion is there, but we don't want to do anything that's going to put gas on that emotion and make it an extreme reaction to that emotion, because then we start finding ourselves getting too sad, too lonely, and too anxious. So finding things that help us to regulate that emotion, like taking some of the gas pedal off that emotion. And so things like meditation, yoga, dance, exercise, there's so many things online available to us right now that we can tap into, free resources to be able to try out different activities at home. When we're struggling with anxiety, writing down facts instead of maybe beliefs or opinions of different people, but the facts that we know. And I think that the CDC is a great place for really looking at what the factual information is about COVID-19, rather than a lot of speculations and tales that are being told around the pandemic. Journaling is also very helpful to stop that spinning of thoughts that are going on in our head, and sometimes our thoughts just get so out of control that we can't really stop it. And so just writing things down so we don't have to keep it inside our brain helps us to put it on paper, get it out of our head for the moment. People are having trouble concentrating, and so making lists, again, writing down facts, stepping away from what you're doing, just taking a break to come back and start focusing again. And an activity called mindfulness also is helpful, where we just focus on what is right in front of you and push away any other thoughts that are coming in at that time, and not really making any judgments. And some of these techniques are things that you can look up online, do more research about, that will help you to find out more information. Another one is negative thinking and rumination. And our focus here is really trying to interrupt our thought patterns. We tend to get into a negative thinking pattern, and we want to stop that negative thinking pattern by recognizing that thoughts are a choice. And we can get stuck in negative thinking, or we can choose to look at what the opposite of that is and focusing on, again, the things that we can control. Sometimes it's helpful just to stop the activity that you're doing and find something else to do to get your mind focused in a different way. And I think the best one is talking to someone who will challenge your thinking and you're open to accepting their feedback. Sometimes we need to have somebody be able to be that mirror for us who says, no way, you're thinking off there, and for us to be open to hearing that. So all of these suggestions are really a matter of increasing our self-care, practicing kindness towards ourselves and towards others. And if you find that the management techniques are not enough to work for you and to manage your symptoms, make sure that you seek out professional assistance right now. And if your situation becomes a crisis, please contact North Central Human Service Center at 857-8500. And one last thing that my boss said as she was reviewing my notes for today, she said, make sure you tell people to find a reason to laugh, and even if that is at yourself right now. So thank you.
Thank you, Tammy. Up next, we have Ellen Bjelland with the NDSU Extension.
Good afternoon. For those of you who are not familiar with NDSU Extension, I just want to give you a brief intro here. NDSU Extension is an educational organization that takes research-based information from the land-grant universities across this country, as well as other reputable sources such as FDA and CDC, and we deliver that education in informal ways to the public. And so that includes families, communities, youth, and the business sector as well. So today I'm going to talk to you a little bit about protecting yourself and others, and actually some of the questions that have come my way in the last couple weeks. So one of the questions is, how does COVID-19 spread? And as you probably already know, it's currently spread person to person, mainly from respiratory droplets. So when we cough, when we sneeze, when we touch a surface that's contaminated, and then touch our face or our mouth, we are then infected. So what's the potential lifespan of COVID-19 on surfaces? Well, this is a piece that came out in the New England Journal of Medicine recently. It is not peer-reviewed, but it is recent. We find that it exists on copper up to 4 hours, cardboard up to 24 hours, plastic and stainless steel up to 2 to 3 days, and fabric up to 3 days. So, as many of us are doing takeout or having food delivered or other things like that, we need to be mindful of what the food is packaged in and consider, how long that virus can live on that surface. So if you're getting takeout, we recommend that you remove the food from the containers and then discard that container and then use your own utensils and plates. And then, of course, wash your hands before you eat. Another question that I got just today was on washing produce. Apparently lots of us are going to the grocery store and picking up fresh produce and wondering, is it safe to eat or not? And for a long time, Extensionist has told folks, do not use soaps, detergents, anything outside of water to clean produce. So wash your hands first and then clean the produce. We recommend just rubbing it under running water, or if it is, especially if you rub it under running water. If it's thin-skinned, if it's fairly thick-skinned, then we recommend that you use a vegetable brush and, again, rub it under running water. So again, we do not recommend using any other types of solutions, including vinegar and water, just simply water. So, what's the best way to protect yourself and others? Wash your hands. Now that might seem also very obvious, but I have learned in just the last year about one of the most important steps that I have missed for years, and that's actually to wet your hands first before applying soap. I was unaware of that. I was just, as most people do, go in, pump that soap, and then turn the water on and wash your hands. You wet your hands first so that the soap can do its job better. So, wet your hands, apply soap, wash for 20 seconds. Now, 20 seconds can seem like a long time. So either sing to yourself or happy birthday a couple of times, or twinkle, twinkle, or whatever you want, or talk, or say, or count slowly to 20, but 20 seconds. And then, of course, rinse your hands and dry your hands with a dry paper towel or with an air dryer. So I don't know that I need to tell you when to wash your hands, right? Everybody knows that message, correct? Okay, so what about hand sanitizers? If you don't have easy access to running water, hand sanitizers are a really good option. So again, they don't clear off all of the germs off of your hands, but they help to reduce the number. So as you do with the water, pump some into your hand and rub your hands and make sure you get in between your fingers, under your fingernails. And the two places that people miss most often are the tips of our fingers and our thumbs. So rub for 20 seconds or until your hands are dry. Again, that reduces the number of germs, but it doesn't take the place of running water if you have it available. A note from FDA, they do not recommend making your own hand sanitizer. And that is because chemical burns have been reported from people trying to do just that. So one of the other questions that I get is, what's the difference between cleaning sanitizing, and disinfecting. Well, cleaning is the all-important first step, and that tends to remove the germs and dirt and impurities from surfaces or objects. And you do it by using soap or detergents, and you physically remove the germs from the surface. So this doesn't, what it does is it lowers the number of germs. So that's our first important step. And then we have sanitizing. Now, in most times, unlike now, this would be our final step. When you think about doing food preparation, after you've cleaned up everything, you wipe off the counters with your dish rag or not a sponge, and then you go to sanitize. And you do that by mixing a solution. It's a very weak bleach solution of just 3/4 teaspoon of bleach to a quart of warm water. And you spray it on the surface and allow it to dry. That's it. But now, in these times, we recommend actually going to the next step up, and that's disinfecting. So disinfecting actually kills germs on surfaces or objects, and this process does not clean things. So again, make sure you clean before you do this, but it does kill germs on the surface after cleaning and further reduces the risk of being exposed to germs or other ailment kind of things. So disinfecting uses a higher concentration of bleach than does sanitizing. So this is where we go to 4 teaspoons per quart of hot water versus, what did we say for sanitizing? 3/4 of a teaspoon. So this is taking it times 12. We're going to have 4 teaspoons per quart or a 1/3 cup of household bleach per gallon of hot water. Of course, you can also, if you can find them, use disinfecting wipes such as Clorox wipes or Lysol wipes if you can find those. So what to disinfect? Well, surfaces such as this or your phone, use wipes on your phone, not dip them in water. Keyboards, obviously toilets, faucets, sinks, doorknobs, light switches, and handles and desks. So I think Derek is able to put up a slide for some contact information for those of you watching this. And if not, then I would invite you to go to the NDSU Extension websites. So the website for NDSU Extension, this is statewide, is www.ag.ndsu/extension. On our front page, you will see COVID-19 resources and a whole section of things to help to fight this virus. I would also encourage you to like our local Facebook page, as well as if you live in another county, like their page. So NDSU Extension Ward County or your county Facebook page. You can also call us at 857-6450, or you can email me or our general office email. Our office email is ndsu.ward.extension@ndsu.edu, and my email is ellen.bjelland, B as in boy, JELLAND, @ndsu.edu. Thank you.
Thank you, Ellen. And last but not least, we have Mayor Sean Sitma with the City of Minot.
Good afternoon. I do want to take this opportunity one more time, as First District Health Unit had pointed out, to offer our condolences, not only from the city, but the county and everyone else listening, to the 9 friends and family who lost loved ones, and especially, again, the male age 50, I think age 55, that passed away recently from COVID-19, or at least complications from COVID-19. So our thoughts and prayers, again, out to those friends and family. I want to touch briefly again on the call for action, or for some of the rules and regulations to be loosened up a bit. Essentially is almost a coin flip on the number of calls from folks on which side of the equation that folks want this to go. And just to remind everyone that we are taking the direction from the North Dakota Department of Health and from Governor Burgum, as they are the lead agency and have been shown to do an effective job through the COVID-19 to this point with their response. So we will continue to follow those guidelines. I also do want to mention that of course, Ward County was the first county to have a COVID-19 case back in mid-March. From that time now, we are within Ward County itself at 20. And I would like to think that that is actually in response to what Lisa Clute from First District talked about, is responsible action from a lot of citizens. So again, I want to emphasize for folks to take that seriously and to don't become complacent with that. We've seen the spread slow comparative to other communities, and I would like to think that we are able to continue down that path. As I mentioned earlier at last press conference, that we are continuing to monitor those social gathering points. I did myself go out Friday, Saturday, and Sunday for a drive to take a look at that. For the most part, I was proud of what I saw, although, as I mentioned, there were some of those pickup basketball games and other things that clearly were not family units with that. But again, I urge everyone to take this seriously, because if we can even slow the rate down to zero, that is going to have the biggest impact for our community, both psychologically within our health folks, but again, on our next big point, and that's on the economics. The economics, of course, are one of those, I think, mental factors that often takes even more pressure upon each and every one of us. And while we are practicing that responsible social distancing and separation, is that we also take that opportunity when available to safely go out and patronize our local businesses, those folks that have gone, I think, to those extra steps to make sure that they offer some kind of service through these very difficult economic times. You can take a look at whether you're in Minot, it would be the Minot Chamber of Commerce, or visit Minot. They do have a very nice list on their social media pages or on their website on who is available, whether it be restaurants or those different businesses that are open or offering some of those maybe reduced what they have available for within their own business model, but also within all of the smaller communities. Reach out to your social media page within your smaller communities and make sure that you support your local businesses, because simply if we don't, we are going to lose businesses if we don't. I cannot stress that enough, and I think the governor has done a very good job of stressing the very difficult economic situation that we are in as a state, as a country, I think globally, but it really does boil down to our small homegrown businesses. So please reach out. We've had a lot of questions about operations within the city of Minot, and I do want to once again stress that City Hall and most, if not all, of our public buildings are closed to the public, and we also are closing our public meetings. But of course, we will have those comment portals open and available that are on our website. You can log on to minotnd.org, and you can file the for different meetings, whether you're support or against any specific items. And of course, the traditional means of reaching out via phone call or email to any of the aldermen or myself is always welcome as well. And we hope to return to normal operations as soon as possible. But again, closing that is again limiting the chance of infection, not only to the aldermen, but for all of the employees who are still here at City Hall. One of the other questions that we received just recently is the city of Minot planning to furlough any employees? At this point, given our income stream and structure, our budget was approved last fall, our income stream is there. We are continuing to monitor the financial situation from sales tax revenues and from oil impact revenues, but at this point, there are no furloughs planned or even contemplated at this time. We still need our police officers on the street. We still need our fire department standing up and ready. We will still patch streets and fix streets, sweep them, and go through our planned routine. However, as I mentioned, as we are monitoring, City Council is also aware, our city manager given the council an estimate of about $10 million in shortfall anticipated for the year ahead. In doing so, the City Council already pushed back or suspended two major projects in anticipation of that shortfall, and we stand ready to react as those numbers become more clear each and every day, week, and month moving forward. However, I do want to emphasize that flood control is not one of those projects, and we are continuing to work forward on our planned schedule with flood control. Finally, I wanted to give an update on our Minot police officer, who was the only city employee that we know of that has confirmed positive with COVID-19. The officer still is at home recovering with the officer's family. Certainly, we hope and want to send them our best wishes and prayers as well as they continue to recover, and hopefully we'll be back on the job in the coming days and weeks. And I also do want to give an update on our fire department. We had some that were self-isolating previously. We have no fire department personnel in self-isolation or and there has been no positive cases of COVID-19 within any of our fire departments. We are at full staff and full stand-up, ready for the community with our fire department. So I appreciate everyone tuning in. I appreciate everyone's willingness to go through this very difficult and trying time. And certainly, we encourage again for folks to reach out to the City Council, to city employees, to myself with concerns they may have. But please understand too that we're in some different times as well in trying to, in some cases, work from home for a few city employees, and for the rest of us field a lot more emails and phone calls than we typically would for this time. So patience is always appreciated. We're going to leave a couple of minutes for questions, so appreciate it. Thank you.
Thank you, Mayor Sitma. So we have 9 minutes open for questioning. Start with you, Jean.
Question for Randy and Dr. Sather.
All right. The question is for Trinity Health, for Randy Schwan and Dr. Sather.
Last week, at our request, Randy, gave us numbers on the number of patients being treated in hospital, and I was hoping that that would continue with each press conference. The number hospitalized, to date, the number in hospital, the number released, the number of deaths.
So, Dr. Sather, Chief of Staff at Trinity. So, the question, how many are being treated currently? We have one patient in hospital currently, recovering.
How many total?
We've had 8 total patients.
And how many have passed?
We have 2 patients locally that have succumbed to COVID-19 or complications.
Okay. And the second question I had for you, Dr. Sather, if a person who was never tested for COVID-19 but is suspected while alive, but is suspected of having COVID-19 and then dies of respiratory failure, then winds up in Trinity's morgue, is that person tested for the virus postmortem? And you might want to repeat that question.
So the question is, if somebody dies, had respiratory illness and dies, was not tested, and is postmortem, would they be tested? It's really a coroner question, but I can, to my knowledge, because I've asked this question of our local coroners, and I know they have tested some patients postmortem, and so that is something that they're doing. I can't speak to statewide, but I know locally our coroner system has done that.
Do we know how many have been tested and what those results are?
To my knowledge, I know of none. But again, I'm not a coroner. None that have been tested have come back positive.
Do we know how many have been
I
tested?
can't answer that. It's outside of my sphere of knowledge.
Where would we find that out?
That would be a state medical examiner question or county coroner question.
Thank you.
All right. KMOT? Another question for Randy.
Randy, how long can Trinity be financially viable when they see revenue losses 50% or greater, as you mentioned?
I'm sorry, I didn't hear your question.
Maybe it's the mask.
Might be
How
that.
long can Trinity be financially viable when they see revenue losses like 50% or greater moving forward?
So the question was, how long can Trinity be financially viable as long as the revenues have been impacted so much, right? So I don't want to get into hypotheticals, but I can tell you that prior to this, Trinity's financial strength was very strong. Because of the impact on revenue And before Trinity's financial stability was threatened, we've made these moves. So we won't have to answer the question, how long can we go? We're going to go and make the necessary moves as we need to make day by day, week by week, to deal with the current reality of lower volumes and increasing expenses. So the moves that we've made so far is to bend the curve on the expenses. And we know that the volumes will pick up. We know that there will be pent-up demand for healthcare services. People have put things off, but we don't want them to continue to put things off if it needs to be addressed, because it could develop into a worst case scenario or worse scenario. And so we know that we will be picking up in some of that revenue and some of the services that we do offer. We are making the moves that we need to make to retain stability. Yes, ma'am.
Will the furloughed employees have access to their 401ks?
Will the furloughed employees have access to their 401ks? That's a question I can't answer. I'm not a financial guy. Yeah, they have the amounts that they have in their 401ks, and whether they dip into their 401ks or not is probably a tax issue that they need to speak with their financial advisor about. Certainly is their 401k to deal with as they see fit. Yeah, I don't know if anybody in the room could answer that question. I probably shouldn't try.
You mentioned anybody who is feeling symptomatic to come down to Trinity and get tested. There's a man in Stanley who's been turned away for testing, and he had a stroke previously and is 58 years old, and he's been turned away, like I said. Is he able to come to Trinity to get tested even though he doesn't have a provider here?
We'll have Dr. Sather answer that question. But that hypothetically, I guess.
So the question, Dr. Sather, Chief of Staff at Trinity, the question is, can someone come and be tested? And you give an example of someone that's had a stroke. And so we have testing available. There's a screening process put in place, and we want people to call. And the screening is actually for two reasons. When you call, you're put through to our first care clinic, and they'll ask you questions. What we get from the Department of Health is actually a 2-page form of questionnaires that we want. The Department of Health actually does our testing. We collect the sample. And part of the screening, and you may be put through to talk to a nurse, is to help determine, do you need something more than just testing for COVID? And now with telehealth available, we might tell patients, you probably should be seen by a provider if they feel a certain level to help guide that patient in the proper thing. We don't want someone to ignore symptoms that should be addressed in a telehealth visit, which is now available, or a face-to-face visit. If someone simply has symptoms and they meet the symptomology, and there's about 8 different symptoms specifically that are looked for, or fever, absolutely they can be tested. And we have a testing process where they can be scheduled, drive up, not even get out of their car and be tested. So screening is twofold. One, to help make sure they meet guidelines for testing, which we get from the Department of Health. But secondly, to help assure that that patient is getting the care they deserve and need for their treatment. We want to make sure everybody is not ignoring a health ailment and not seeking the appropriate health out of fear that they might be exposed to somebody with this. That's why we're all wearing our masks if you come into the hospital. So yes, there's treatment available in drive-up. There's treatment available in person at clinics. There's telehealth available to help make decisions of the best care for yourself.
I have a follow-up on that question for Lisa, actually. My colleague did mention that there's been at least one patient being turned away, not in the first district.
Okay.
But I did notice that last week, numbers compared to last week, there are some areas where very few tests have been conducted. Burke County, only 8 tests were conducted. McHenry County, only 22 tests. Renville County, only 16 tests. Sheridan County, only 4 tests in the last week. Are there providers that are turning patients away? Is First District working with providers to make sure that there is enough testing available and that patients are not being turned away?
Yes. The answer is yes.
I don't
we have been, okay. The question was, is First District, are providers within all of First District, particularly the rural areas, do they have testing capabilities, and are we aware of anybody being turned away? And I am not aware of anybody being turned away. I can give an example. Last weekend, we had a call from somebody. I contacted my staff person who called the provider that was in a rural area, and they said absolutely, and within an hour that person was tested. So I'm not aware of any situations that they have not been tested when it has been identified as a need.
Can you go over the criteria which people can be tested under? The fever, and then a couple weeks ago you read the symptoms that qualify you for a test. So for all those people in those rural areas, can you let them know the symptoms that would qualify them for a test?
I can. Some of that has changed. I can post that up on our Facebook, and I don't have that document with me right now, but I can certainly make that available to the public. And I know that that is available to the public on the North Dakota Department of Health website, so they could receive any guidance there. Jen? Thank you.
All right, we have reached our time. Thank you, everybody, for coming, and we will see you next week.